I became involved with the aged care facilities and senior private for-profit facilities when my dad suffered a series of major TIA strokes and lost his short-term memory. For the first year or so that he was there, the only major complaint I had, being an assisted living facility, was lack of stimulating activities and the food. However, after he became palliative from liver cancer in May of 2011 is when the horror story started. Originally, the first was when he was overdosed at the change of medication from T4s, which is a codeine medication, to fentanyl, which is a morphine medication, and he was given both for 4 hours, for the patch and then the codeine for 24 hours, to the point that he was horrifically overdosed. I didn't get satisfactory answers from management on the handling of that, so I lodged 3 care issues with Protection for Persons in Care, and after the investigation they found in favor with me of 2 of the 3. I believe really direct retribution was taken toward me and my dad because I did, even though nobody will admit to that, because his care did not improve. In fact, it got worse. To the point where the last night I had him there, they physically wanted to drag him to the toilet with a strap around his chest as opposed to wheel him to the toilet. He was not yet on incontinent product. His scrotum was blistered raw from not being changed properly or timely. His teeth hadn't been out of his mouth and I don't know how long. In fact, we had to pry his teeth out to have them brushed properly and put back in his mouth. And it took 2 days of using one of those swabby sticks to get all the plaque and stuff out of his mouth. The facility, in my opinion, for the type of care that they want to give, the government wants these people in these for-profit scenarios and out of long-term care. They're not staffed properly. This particular facility, at the time my dad was there, had 1 LPN for 44 residents and 6 healthcare aides. There is no way in heck that anybody can administer medication for 44 residents without some kind of errors. After obtaining my dad's records, on more than 1 occasion, in fact 5 occasions, medication was taken from his supply for other residents and never returned, and we were never compensated for it because they don't order their medication in a timely manner. As well, the medications that are ordered have to come from Medicine Hat to Brooks. Minister Horn, we've been to Edmonton. We have talked to you about this. You have sent the investigators down. They were found in non-compliance. You promised us that report. We're still waiting. It's 3 months past the fact that you promised it from.